We have Professor Teo Yik Ying online right now with us. He's the Dean of the Swee Hock School of Public Health at the National University of Singapore. Now, for those of you who are watching us as well, if you have any questions for Prof. Teo, just ask them in the comments below our live stream. Now, Prof, let's start off with the first question. Now, PM Lee and the Multi-Ministerial Task Force has asked everyone to stay home and only go out when absolutely necessary. Now, with all these new tighter measures, if everyone cooperates, could you explain for our viewers how do these strict measures work like a circuit breaker?
Well, essentially, if you look at what is happening now, we have closed schools. We have also closed the majority of the workplaces. And this actually restricts the number of people that are moving in the community, that are moving in public spaces. Let us look at both measures separately. At workplaces, the recent number of infected cases clearly show that actually a lot of community transmission out there happen at workplaces. You have the Keppel Shipyard cluster, the cluster at the Maxwell MRT station, the cluster at Singapore Centre. These are places that the public will go to, places that people work at. So you can either play catch up or you can plan ahead and break any transmission chains that are happening because people are going to work and getting infected. And by closing non-essential workplaces, the amount of people interacting in the community, in offices, public transportation, eating spaces, people have to eat when they go to work as well. These people interactions will decrease significantly. And it's very clear, with less people interacting, there will be less chances of any community transmission. The infection dynamics clearly show this. And very clever people using mathematical models have shown that this will be effective as a circuit breaker. Now, if I could also touch on the schools, actually closing schools, I must emphasize this is not a U-turn in any measures. The coronavirus situation constantly evolves, and our measure as a nation must change correspondingly. 2 weeks ago, after the March school holidays, the new cases were mainly from importations, especially from America and the United Kingdom. We put in place the measures. We isolate these returning travelers in hotels for 14 days. It is the same approach right now. Closing schools substantially remove human traffic from the public, from public transportation. Right now, we have been emphasizing that people ought to stay at home unless absolutely necessary. Closing schools as part of the circuit breaker for a period is aligned to the current measure, minimizing human traffic and density in public spaces.
Prof, I just want to touch in terms of the efficacy of these measures. Now, say all of us, we cooperate and we, practice these safe distancing measures. How long or short a period are we looking at for these measures to bear results?
So on this point, we have to be very pragmatic, and I think the minister have mentioned this as well. If we put in place, we will start this next Tuesday for workplaces, next Wednesday for schools. It is important to know that it will take a while to see the effect. It doesn't mean that within 7 days or 14 days, suddenly, miraculously, there will be no cases in Singapore anymore. I have to remind everyone that what is happening in terms of the number of reported cases that we see for the past few days really reflect the transmission that were happening in the public spaces, in the community, 7 to 14 days ago. So this tells us if we put in place the measures now, it will take a while for the measures to be effective. I must mention this because it is very important. These measures do not mean we will completely see zero transmission after 1 month. What we are doing effectively is to shift the transmission patterns from the community to the households. And when we do that, there will be people who will be infected because now people are staying at home, people are interacting at home. This is really where we have to come back to very basic principle. Because we spend more time at home, the transmission will come to the home, and people who are exposed and infected already but have yet to display symptoms, they don't know that they are infected, they don't know that they need to see to see the GP or to go to the hospital. They can infect others in the same household. And this is why everyone will still need to be responsible, even at home, monitor temperature regularly, cover mouth and nose when sneezing and coughing, and washing hands regularly with soap and water. One final point, my recommendation is that during this crisis moment, we may need to respectfully remind our elderly parents or grandparents that we may not be able to hug them as often as we do, be as physically close to them as before, but this doesn't mean that we cannot show our concern for them to continue speaking to them, checking on them, either via the phone or through a safe distance, 1 or 2 meters across the whole living room. Back to you.
Of course, for those of you who are watching us right now, if you have any health-related questions for Prof. Teo, you can leave your questions in the comments section below. Now, Prof, I just want to move on to a very hotly debated or talked about online, the issue on mask or the matter on mask. Now, of course, earlier on, PM Lee as well as the task force has said the government is no longer discouraging people who are well from wearing masks. And wearing a mask may help to protect others in case you have the virus but don't know it. Now, this is so that you keep your droplets to yourself. What's your view on this, Prof?
So your sentence actually very rightly touched on it, that it is to protect others. First point that I want to make, that it is because if I'm infected and I cough and I sneeze, I'm projecting droplets from my mouth and my nose outwards to the public. And this is where having a mask, having a barrier helps to contain as much of that as possible. Now, I have to mention that in public spaces, I have seen people wear surgical masks or other forms of reusable masks, but when they want to cough and when they want to sneeze, they actually remove the mask, cough or they sneeze in public with no barrier, and then put that back on. That is not the point here. The point is wearing a mask, you have to continue wearing it if you're coughing or sneezing. On this point of mask, I'm very glad that the government highlighted the fact that there will be a distribution of reusable masks. Please take note, if you are feeling well, try not to use surgical masks. Worldwide, there is a global shortage of surgical masks out there. We need to keep the supply of surgical masks for the healthcare workers because they are in a high-risk environment. They are constantly exposed to aerosols or these droplets because in a hospital setting, patients are coughing and sneezing a lot. Our healthcare workers need to be protected. So the right approach here is when you get your reusable mask, please make sure that you use them, but equally important to learn how to wash them properly, how to take them off, and how to wash them properly before you reuse them.
Right. Now, Prof, we have a question right here from one of our viewers, Ollie Q. Now, Ollie is asking, again, in relation to the mask, which is better protection from the virus, wearing masks or washing hands thoroughly? Now that the government doesn't discourage the wearing of masks, do you think people will become more complacent about other personal hygiene habits?
This is a very important point. So when you wear a mask, you are trying to protect others because you may be infected. How do you protect yourself? Protecting yourself, it is still back down to the very simple basics. People keep wondering, why is the government, why are public health experts always telling people just wash your hands? The reality is that when I cough or when I sneeze, if there are no people around me, the droplets actually will fall on surfaces like tabletops, like handholds, like door handles. And this is where if someone who is well touches these surfaces and subsequently touch our face or touch their own face, this is how one actually transfer a virus from someone who is infected to a surface to someone who is healthy and in the end getting infected through this dynamics. This is the reason why we remind people, wash your hands as regularly as possible with soap and water. If you are really in an environment you can't get access to soap and water regularly, easily, this is where hand sanitizers come in useful. But simple, basic personal hygiene remains absolutely important. It doesn't mean that because now you have a barrier, be it a surgical mask or a reusable mask, it means that now you're protected. Far from it. Your hands are still your most dangerous points. You have to keep washing them to minimize the risk, your personal risk of infection.
Right. I suppose also it's to prevent, and of course not to touch your face, right? Even you have your masks on. Now, Prof, many reports are also saying that the coronavirus hits the vulnerable groups the hardest. For instance, the elderly and those with pre-existing medical conditions. There seems to be a perception then that the younger people will not be so easily infected. What do you have to say to the young people and what advice do you have for them?
So presently, when people read what is happening elsewhere, a lot of global media actually focus on the number of deaths that had happened, and a lot of these deaths have unfortunately been affecting the elderly, the older people. And this has led to young people who thinks that because they don't have any pre-existing conditions like diabetes or any respiratory condition, because they are not old, they are very young and they're healthy, this has led them to think that actually they are immune or they are less likely to be infected. Even if infected, they are mild. I have to mention here, young people are not immune. And let me repeat this. Children and young people can equally be infected by the coronavirus, just like you, just like me, just like the elderly. I mentioned that they may suffer from milder forms of infection, but we have seen cases from China, from Italy, from Spain, and now from America of children and young adults with very severe form of infections. Some of them have died from it. So repeating this, children and young people can be infected by the coronavirus. They are not immune. That's why they have to take in mind the same kind of precautions and messages. You have to stay at home. When you're out, practice physical distancing and the need to practice personal hygiene. Wash your hands often, cough and sneeze with a barrier, and definitely cover your mouth if it's possible.
Right. Well, thank you so much, Prof, for the invaluable advice. Clearly, like you mentioned, it's important to stay at home, practice good personal hygiene, as well as if you're unwell, just stay at home. And that was Professor Teo Yik Ying. Now he's the Dean of the Swee Hock School of Public Health at the National University of Singapore. For more on the announcements on the latest stepped-up measures to manage COVID-19, do log on to straitstimes.com. Once again, I'm Haryanto Diman, and I'll leave you with this video from doctors and nurses on why you should stay home. Please have a good weekend and stay well.
Stay home, stay home, stay home.
Stay home. Over the past few months, I've witnessed my fellow healthcare colleagues making personal sacrifices to get infected patients back to full recovery.
There are more and more unlinked cases, which means people are passing infection from one to another. I need you to keep safe, and I need you to stay at home, try not to go out. If you have to go out, stay 1 to 2 meters away from anyone.
Because by staying home, you have less chance to get infected, and if you're infected, then you have a less chance to spread.
Because many people are infected and infectious before they develop symptoms. So to protect others, we should try to minimize contact.
The next few weeks will be crucial in our efforts to contain the coronavirus. The healthcare workers, cleaners, contact tracers, all are doing our job for you. You, the public, can help us by staying at home. As the saying goes, we come to work for you, you stay at home for us.
Practice safe distancing. Stay home. Keep yourself safe.
Keep our patients safe.
If you really have to go out to public spaces, remember the following. Maintain good personal hygiene. Wash your hands often with soap and water. If you have to cough or sneeze, cover your mouth and nose and wash your hands after that. Take your temperature twice a day.
So please listen to medical advice and play your part to keep those who are unwell out of public spaces.
We work hard at the clinic to keep everybody safe. The rest of us stay at home and be safe.
We are working very hard at the front line, but we can't do this alone. We need your help. Help us stop the spread.
So please do your part and don't go out unnecessarily. If you have to, try not to touch anything, especially your face. Avoid crowds and wash your hands whenever you can. It will help to stop the spread. So please protect yourself and your loved ones.
This is a time for you to play your part for our country, our friends and loved ones. You are the most important defense in this war. Stay at home.
Stay at home as much as you can. Avoid social gatherings beyond your immediate family. If all of us can do this, we will succeed in overcoming the virus.